Hello, everyone. I am Dr. Hope Watts, board certified family physician, health coach, speaker, and lifestyle manager. I'm sorry, I just got disturbed. Glad you're here today. And we're going to talk about colon cancer today. And this is in reference, and this is to really piggyback on a person in our midst. It was here and now has gone. Chadwick Boseman, who decided, who had the diagnosis of colon cancer, as you know, and decided to keep it private. But at this point, we want to just say a few words about him. When I first saw the previews for the Black Panther, I was exhilarated. I couldn't believe that there was someone that was actually a Black superhero. And I said, no, I know I have to go and see that. When I saw it, I was thrilled to bits and so proud of the storyline and how it unfolded. And I was very saddened and shocked that he passed. But he was a giant, a titan in our community with what he did. And I happened to listen to his inspirational talk at the Howard graduation. If you get a chance, go to YouTube and hear that. I felt that talking about colon cancer is something that really needs to be done. And as I think about it, I realize that in most situations in our health facilities, it is not emphasized. I mean, everybody knows where to get their breast cancer screening from. I think I was visiting my sister one day, and an advertisement came up for the radiology department, and the radiology department was saying you can come and get your breast cancer screening here, and they had a little video and everything. But in order to get screening and information about colon cancer, you really have to be going on a regular basis to a professional who is aware and wants to make you aware of all the screenings besides colon cancer, because there are other screenings too. And so we are going to talk today about colon cancer and screenings, and we're going to also talk about why Afro-Americans have such a high rate of colon cancer. And we'll delve into that a little while. We'll talk about how to be screened and what type of screening things you can participate in. And then we'll talk about some things that can help you lower your risk of colon cancer. So let's start. Colon cancer is the third most common cancer in the United States. I believe lung. Hi, Pam. Good to see you today. Thanks for coming to hear our talk on colon cancer. It is the third, and that's the third after lung cancer and breast cancer. And I don't see any public service announcements about it on the TV. I don't even see any commercials about it at all. So it is something that's really in the bastion of a private office, and you have to come on a regular basis so that the doctor or the whoever you see can give that information to you. It's also the third leading cancer, leading cancer that causes deaths in this country. And I'm going to use colon cancer and colorectal cancer interchangeably. I haven't changed any of the words. I'm just using them interchangeably, but they mean the same thing. Colorectal cancer is the third most common cancer in Afro-Americans also. Additionally, Afro-Americans have a very high rate of colon cancer compared to the general population. Now, there are several governing bodies that recommend screening for colon cancer, and one is the USPSFT, and that's the one that my board uses almost exclusively. And they recommend that screening should take place between ages 50 and 75. However, American Cancer has been recommending screening at age 45. But the downside of that is that some people who have insurance, hi Elaine, good to see you. Glad you're here, and we're going to do a really nice talk on colon cancer here. The problem with the recommendation of 45 is that some insurance companies won't pay for certain screenings at that time. So you really have to work. If you want your screening a little earlier than 50, you'll have to work with your doctor to make sure that you can get it paid for or do some other type of screening besides maybe a colonoscopy. So let's talk about the high-risk groups that have a higher risk for getting colon cancer and maybe getting it earlier. Now, I just want to reiterate that routine screening is really what we want to do to prevent colon cancer, because we can find it earlier and we can, and almost in some cases, bring a resolution to the symptomatology. I'm not guaranteeing that. Nothing is guaranteed in medicine. So let's go back to the high-risk groups. Afro-Americans are a very high-risk group. People who have personal history of colon cancer or family history of colon cancer are in high-risk groups. And so they should get colon cancer screening earlier than the 50 age, at age 50. In our country, we eat a lot of high-fat foods with low fiber, and this kind of creates a system where we are making it worse for us to have colon cancer. Sedentary lifestyle. If you are a couch potato, you are definitely going to have some challenges, as we'll find out a little later. Diabetes is supposed to also make you at risk for colon cancer. Obesity. Obesity is very common in our society, and it causes an increased risk for colon cancer and an increased rate of death for colon cancer. What I found interesting was that American Cancer Society doesn't even have all these risk groups that I have here, but they have no recommendations for high-risk groups. So it's incumbent on you to really know what colon cancer is, what the risk factors are, and how you can prevent getting it. So let's delve into why some people think that Afro-Americans have a higher risk of colon cancer. One statement was, hi, Dr. Ferlandi, good to see you also. One statement was that Afro-Americans don't come to screening. But as I told you, how are they going to know to come to screening if no one is saying this to them on a regular basis? Also, they are less likely to come to medical attention in the earlier stages. But it's still part of that same thing. They have to be notified and be told when, and they have to have insurance also. And so if they come later, it's going to be harder for it to be treated, and there may be a higher risk for death. Diet. In our cities, we have deserts. We have food deserts in quite a lot of the large cities. Many of the grocery stores that used to be there are gone, so no one can get fresh fruit. There may be a convenience store, and the convenience store may have some fruit, very little vegetables. They may not be high quality, and so people don't buy them. The other thing is lack of access. There are many issues associated with this. Lack of access meaning you can't get an appointment. There may only be few doctors there, or you have to have a certain kind of insurance. Even if you have insurance, certain doctors don't take all insurances. And the fact that some jobs don't allow you time to go off and get your screenings. You actually have to call in sick to have time to do that. The other thing is tobacco smoke. It was mentioned in the Afro-American group of risks, but I think that risk is also prominent in the majority culture, Caucasian. And some people do have a lot of cancer in their family. And if you have a lot of different kinds of cancers, make sure you get screened a little earlier. The other thing, these are like social things I'm going to go into now. We as Afro-Americans do not discuss our health problems with each other. We don't even tell other people that are in our families. And so in order to make sure that we're, getting people in early, we have to know that information. And I'm going to tell you a story. I had a patient I saw earlier this year, and the only reason why she came in was to get her breast cancer screening. And so when I came in the room, I said, I don't think you need to be here because you can just go to the radiology department and just sign up for the breast cancer or the mammogram. And she said, well, no, they told me to come in here because I need a special mammogram. So I knew what that meant. She needed a diagnostic mammogram. And that meant that she had something wrong with her breast. So I was trying to be very diplomatic here. And I said, well, they only send you here if they think there's something wrong with your breast. And then she began to tell me about the fact that she had someone who told her that she had a breast lump. And they put a clip in there to identify it. And she was very upset about that. And they should never have done that to her. So I asked her, when did you get this done? She said, 2 years ago. So I knew I was in for trouble. So I let her get undressed and I did her breast exam. Indeed, she had 2 lumps in her left breast that had been lingering there for 2 years. So I did give her a mammogram and send her on her way, but I'm saying all this to really point out how fearful people can be about, number one, getting screened for colon cancer, and number two, when a diagnosis is made, this lady let that go for 2 years. I did ask her about her family. She says, only my son lives in the city. I said, well, does he know about your condition? She said, oh, no, I never tell my son any of those things. So we have to be at a point where we can discuss those things with our family members or our besties. And I would strongly suggest, if you are going to get some type of screening other than just colonoscopy or some type of procedure, that you take someone with you. Because if you're that scared, you may not remember everything they say. And that story was to also illustrate fear and anxiety. You can be paralyzed by fear and not act on good information. I can't tell you how many people I've told to get colon cancer screening. And here it is, they come back for their physical. And, well, Mr. Jones, did you get your colon? No, they never called me. So I'll look in the chart and find out he's been called 5 times and he never responded. So fear can prevent you from getting your regular colon cancer screening. So what is colon cancer screening exactly? Some people feel, oh no, they're going to try and do some procedure on me and I don't really want to be a part of that. But the whole goal of colon cancer screening is to make sure that people get screened early and not late. so that we can find these precancerous lesions earlier so that we can definitely treat them or remove them. It is theorized, and I say theorized, that 90% of all colon cancer cases or colon cancer polyps or precancerous lesions can be preventable if we remove those polyps. But that's theory. I'm not sure if that's the reality. This can be completely true if everyone equally has the same type of insurance. And as you know, some jobs have minimal insurance, and some jobs don't even pay for colonoscopies. Or they have insurance and they pay very little for it. And so it's almost like not having insurance at all. And the colonoscopies and the Cologuards, which we're going to talk about later, are on the higher side. They're not very inexpensive. So let's talk about some of the testing that we need to do for colon cancer screening. Now, these are stool tests. I know, hope you haven't eaten recently, but just a small amount of stool you're going to put on these little cards. So the one that I recommend the most is a FIT test. This test is a series of 2 to 3 stool cards. You just put your stool on there after you have your bowel movement, and there are no dietary restrictions. And you have to do this every year. And these are probably some of the least expensive type of screenings. But if they come back positive, you will probably need to go and get a colonoscopy. The next test is called a Guaiac test. That one has several restrictions. Number one, you can't take vitamin C. You can't take any over-the-counter medication like Advil or Aleve for at least 4 or 5 days. And they frown upon or restrict the amount of red meat for you to eat in the 3 days before you start doing that. That's every year also. But here's the caveat. I have given these cards out, I can't tell you how many times. And what I hear is, Dr. Watts, I'm going to bring it back. I said, well, you said that last year. Oh, this year's going to be different. I'm coming back next week. I'll be right here with my son. So a month later, I get a little alert on my electronic medical record stating that Miss So-and-so did not bring her cards back. So there are good points and bad points. So we're going to make you responsible for bringing those cards in. Cologuard. You've seen this on TV. You've seen the little box walking up the stairs with the Afro-American gentleman, and he avoids the elevator because he wants to keep being active. And this little box is having this conversation with him about getting colon cancer screening. This is a very good way to get colon cancer screening. For number one, you can't have, I don't give this to people who have cancer in their family, colon cancer in their family. And number two, they don't have a history of colon cancer themselves. But that's a good way to screen. It is covered by most insurances, but you have to return the box back. And I find that many people who really hate me to say the word colonoscopy, their faces brighten up. They almost have a smile on their face so that they can go ahead and get it done with and cross that off their list. And of course, the gold standard, the best type of test available is a colonoscopy. Now, this is a procedure, so they'll have to put you to sleep for a little while. And it means that they're going to take a lighted tube and snake it through your colon, the whole colon, and take parts of tissue and send it for biopsy. And if they see a polyp or so, they will snag that out and send it for biopsy also. And what I need to tell you is that those polyps that they take out, they send them to the pathology department, and one of three things can happen. The biopsy is negative. There's nothing there at all. Number two, there could be a polyp there, a precancerous polyp. And so your doctor will probably recommend that you come back for a repeat colonoscopy in 3 years. Number two, you could have a polyp, but it's a precancerous polyp, and they're going to need to see you back in 5 years to make sure that it has not grown. And that's another way they help prevent colon cancer or some other types of growths. So What if you've been having some symptoms that you're unsure of? What about if you're really concerned about colon cancer, or you have a relative that's concerned about colon cancer and you know they do not go to the doctor like they should? Let's just talk about some of the colon cancer signs that you should be aware of. Bleeding from your rectum. This could be bright red blood. Sometimes it can be black as tar. Any type of blood you know is abnormal, bring that to the attention of your doctor sooner than later. I usually give a time frame 2 weeks at most, and if it's dripping out, you need to get to the emergency room. Persistent cramping or abdominal pain. Now, some people may have gas and bloating, and they know what that is. But I would say after age 50, or if you're in a high risk group, you should not wait any longer than at least 2 or 3 weeks. And we talked about those high risk groups earlier. Weakness and fatigue. You can't explain why you're feeling more tired than normal. And especially if you have some of the other symptoms that that you have in addition, such as the cramping and the abdominal pain and the bleeding. Unintended weight loss, because with any kind of cancer, there may be some weight loss. And if you're not sure, just bring it to the attention of your doctor. Persistent changes in your bowel habits, diarrhea or constipation. You're always having diarrhea or constipation. It doesn't necessarily mean it is cancer, but you need to bring it to medical attention, because then they can determine if it is cancerous or not, or some other type of condition. Another persistent change could be narrowing of your stools. Your stools are like pencil thin now. They're not that large caliber stool that you've had before. Another possible symptom of colon cancer is feeling that your bowels do not empty completely. And you've gone there and you just feel like there's something still in you haven't evacuated everything in your colon. So let's just recap here. We've talked about colon cancer screening, and we've talked about some of the ways that people do not get colon cancer and why Afro-Americans per se do not come to medical attention. We've talked about some of the disparities with how information is given out to Afro-Americans and maybe other minorities too, and some of the issues that can bring about, we talked about fear and anxiety that prevent people from actually being persistent with their care. So I would like to, at this point, talk about some other ways that you can help prevent or lower your risk of colon cancer. By all means, get screening, and we talked about that. And we talked about the cards that you can get and the little kit that you can bring home and the colonoscopy. And I would say for Afro-Americans, probably 40 to 45, that may be the age. And you may not be able to get a colonoscopy, but surely some of the cards for testing may be something to consider because they are cheaper. And as I said, make sure you turn them into your doctor, and you should follow up to make sure what the results are. Be on top of things. Make sure the doctor is getting them to you, getting the information to you. The other recommendation is eating lots of vegetables and fruits. As I did say that in some areas, in some large cities, there are food deserts where there are so few supermarkets or stores that sell fresh fruits and vegetables. Sometimes that's very hard for some minorities to get those types of fresh fruits and vegetables. So, in speaking of a diet that has a lot of fresh fruits and vegetables, what comes to mind is the Mediterranean diet. And if you were here a few weeks ago when we were talking about different kinds of diets, that particular diet recommends a lot of fresh fruits and vegetables. It also, as I told everyone, there's no fast food in there, okay? And really, I think most of it's fish and chicken. They don't have a lot of red meat in there. The recommendation is to eat less red meat. Avoid highly processed meats such as hot dogs and lunch meat. And, there's a lot of preservatives in those things also. And if you have to go to fast food, pick the healthy choices. Quite a few of them have salads there, fries, probably not. They have grilled burgers. A friend of mine always buys her grilled burger at Chick-fil-A. And she was a good impression on me because I was buying those little nuggets because I love the nuggets. I have started doing the grilled. Hi, Jillian. Good to see you today. I have been doing the grilled chicken sandwiches, and I get the extra lettuce and tomatoes also. Get regular exercise. In our fast lives, we have a lot of things that we do. We have a household to take care of. We have children to take care of. We have to shuttle them to different things. Now, it's changed since COVID, so we shouldn't have as many excuses as we've had before. So get out there and put your 30 minutes in. We talked about that in our prior talk about exercise. Get 30 minutes in a day and just do it every day. Brisk walking or something else. Peloton is very popular now. My chiropractor recommended if I didn't want to get the bike, just do the Peloton videos. You can just get the app, the Peloton app, and do your own cycling in your own home for less than a third of the price, I guess. Excess weight. This seems to be coming up quite a few times, and we've talked about it a little earlier. It is one of the higher risk factors for colon cancer, and it puts you at higher risk for death from colon cancer. Being overweight or obese increase your risk, increase your activity, and if you're earnest in trying to lose weight and you're having difficulty, please contact your doctor. He or she may have options for you that will help you get over the hump, or suggest another specialist, a nutritionist or health coach like me, and you will be able to bring your weight down. And the other thing about doing that is that it's going to decrease your risk for diabetes, high blood pressure, heart attacks, and strokes. So weight loss, as I told my patients, somewhere, somehow, some doctor is going to tell you, you need to exercise. So why not make it beneficial for yourself? Smoking. Long-term smokers are at high risk for developing and dying from colon cancer. Now, to this list, you have to be very specific these days. You can't just say smoking. I said cigarette smoking, cigar smoking, because among women, black and mild, down where I am in North Carolina, is very, very popular. And so what happens is they tell me, well, I only smoke one or two black and milds, but in some cases, black and milds are worse because they have no filter. So you're getting the full effect of the tar, the nicotine, and all those chemicals. Lastly, vaping. This was not in the references that I looked up, but vaping has a lot of other chemicals in that we have not even tested at all. And should we be smoking that stuff? If you think about it, you're taking all those chemicals, they get dispersed to other areas of your body. No, that should not be something you would want to do if you want to be healthy. And we're hoping that you want to do some healthy things. So if smoking is an issue, talk with your doctor about it. There are many anti-smoking things. There are things over the counter. There are call-in programs. There's a hotline you can call into. If you get a prescription strength medicine for smoking, to stop smoking, they have a hotline. You can call them up anytime, day or night, and they will give you information on quitting smoking. But lastly, limit your alcohol. I know during COVID, a lot more people have been drinking more, eating more, was because we talked about that, the corona belly, and probably feeling more depressed. And sometimes alcohol calms people down, and people may be drinking a little bit more than they should. So the recommendation is, hi, Dr. Andrea. Glad to see you today. Um, to limit the amount of alcohol you drink. One drink is 12 ounces of beer, or 5 ounces of wine, or 1.5 ounces of distilled hard liquor. And it should be done at least no more than once or twice a week. Now, there are some people who are really creative and they decide that they are going to binge on the weekend. They figure, look, I haven't done anything during the week. Please do not binge, because it's very detrimental to your liver. And as we know, it's one of the risk factors for colon cancer. So I would entertain any questions or comments at this time. And I hope this has been helpful and gives you something to reflect on. And this information is not just for you, it's for you to share with everyone else. And if you do want a tip sheet, if you send a request to my email, drhopewatts28 I'll spell that out for you, DRHOPEWATTS 28 @gmail.com. I will be happy to email you a tip sheet. So any questions or concerns or any points that you would like to bring up at this time? You're welcome, Jillian. Thanks for being on. I'm glad the information was helpful. And okay. All right. Well, we'll bring this to a close. And I thank each and every one of you. Well, thank you, Charlesette. I was getting ready to leave, close it down. Thank you for coming in and sharing with us. And I'm glad this information was helpful, because I feel that we can never have enough information, especially about health care. And the more we have, the more we can ask questions, because sometimes we don't even have enough information to ask questions. So it's always good to have extra information. So I thank all of you for coming and participating, and stay tuned, because I'm going to have something else that's going to be high powered next week. And as I said before, I'm not sure if Charlesetta, you heard that if you want a tip sheet, just email me at drhopewatts28 @gmail.com. And I'll spell that out for you, DRHOPEWATTS @gmail.com. So thank you, everyone, for your listening ears. And I am so glad. And I didn't really want to bring Chadwick Boseman. In some ways, he has done other things. He's done so much with his life, but even in his death, he has brought about really a transformation, because I know more people are going to be looking at colon cancer as something to keep on their radar. Okay, I have a question here. It says, what age do we start checking? The American Cancer Society feels that 45 should be the age that we start doing screening for colon cancer. But as we discussed, the colonoscopy and the Cologuard, the insurance may not pay for it at that time. So the Fit cards or the Guayat cards are probably an alternative for you, and you can ask your doctor to do that. Evidently, Chadwick he died at 43, so he found out when he was 38, so that the 45 is still a little, 45 is still higher than he had it. And I actually had a friend who was diagnosed with colon cancer at age 41. The symptoms that we talked about, digestive problems that are persistent, they should be brought to medical attention. It doesn't mean you have colon cancer, but you want to make sure that there's nothing else going on. So I would say start at age 45, and you may not be able to get a colonoscopy, but you will be able to ask your doctor for those stool cards and bring them in. And as I said, follow up to make sure you get the response that you need. Any other questions at this time? Okay, well, thank you everyone for coming. And I hope this information has been helpful for you. And I am Dr. Hope Watts, board certified family physician, health coach, speaker, and lifestyle manager. And you can follow me on Facebook, LinkedIn, Twitter, Instagram, and Pinterest. And thank you so much. Have a wonderful week.